Hi, my name is Peyton Edwards, and I'm doing the disease Mycobacteria Leprae. I chose the disease because I've heard and seen studies about it on the Discovery Health channel and was interested in learning more about this topic. The physical characteristics of M. leprae is that it is a gram-positive bacilli, it's an acid-fast organism, and it has parallel sides with rounded ends, and it also is rod-shaped. This bacteria grows best in a 30 degrees Celsius atmosphere and shows preferences to cooler regions of the body. There's two forms of Mycobacterium leprae. The first one is multibacillary leprae, and the second one is pulsibacillary leprae. The population at risk for Mycobacterium leprae is Southeast Asia, the Eastern Mediterranean regions, Africa, Brazil, and it also occurs in all regions of life. You can be a male or female. It is more likely to peak in children who are around the ages of 10 years old. The most recently found cases of leprosy were found in the United States and came from immigrants that relocated from their homeland. The places that the new cases were found included Louisiana, Texas, Florida, and along the Gulf of Mexico. All right, there are two forms of Mycobacterium leprae, like I stated before. The first form is multibacillary leprosy, and it's also called lepromatous. This form of leprosy is for the patient that has a weak cell-mediated response, and it is categorized by an extensive skin involvement, meaning skin lesions become infiltrated. And you'll find these lesions, like I said earlier, in cooler regions of the body that include the groin, axilla, the second form of leprosy is called pulsibacillary leprosy, and it's also known as tuberculoid leprosy. Patients that have a strong cell-mediated response are able to kill off this bacteria. This form of leprosy involves the skin and nerves, and a number of lesions can be limited but are dry and hypoaesthetic. According to the CDC, scientists believe that leprosy is transmitted by people who are coughing, sneezing, and someone who is already infected, and the other person is breathing in their bacteria cells. Symptoms of leprosy in general are thick, dry skin, painless ulcers on feet, loss of eyebrows or eyelashes, numbness to the affected areas of the skin that may or may not be replenished. They might be damaged forever. There is muscle weakness and paralysis of the hands, and eye complications that could possibly lead to blindness. Okay, common treatment plans for Mycobacterium leprae involves taking 2 to 3 antibiotics. This is known as multiple drug therapy. The common drugs used to treat leprosy is dapsone, rifamycin, and clofazimine. Treatment for leprosy lasts about 1 to 2 years depending upon how you are accurately taking care of yourself. Another treatment for leprosy is called the BCG vaccine, and it provides some protection against leprosy. The BCG vaccine has a higher rating in younger individuals that receive the vaccine and a protective efficiency of 50%. All right, prevention plan. The World Health Organization recommends that the community gets together and not only becomes aware of leprosy, but also attends to national programs, taking seminar classes on how to deal with an epidemic outbreak of leprosy if it happens, and having certain individuals train to become prepared if that epidemic were to happen. To prevent leprosy, the community needs to promote innovative approaches for sustaining and exercise in a leprosy course. Also, prevention plan is the use of a prophylactic antimicrobial agent that will help with leprosy and from it spreading to other people. Another prevention plan step is to stay committed to national programs. The World Health Organization has a great program that informs you all about leprosy and how you can donate and how you can be involved. The World Health Organization recommends that all patients use a long-term multi-drug therapy because it has been proved that it is the most efficient drug. There are many treatment plans to leprosy depending on the type of leprosy that you can receive from someone who has leprosy. The multibacillary treatment plan is recommended to take 100 milligrams of dapsone, 50 milligrams of clofazimine, and that will be administered self-daily. Next is the monthly supervised visit treatment plan that involves taking 600 milligrams of rifamycin and 300 milligrams of clofazimine. And these treatments will last up to 12 months depending upon how you are taking the medications and if you're staying regular with it. For the bacillary leprosy, the daily self-administered treatment is 100 milligrams of dapsone, and the monthly treatment is 600 milligrams of rifamycin. And this treatment plan, again, only lasts 6 months if you are taking your antibiotics every single day and staying on top of that. Well, thanks for watching my video.